Hey, everybody, welcome to today's lesson about legal responsibility surrounding medication administration. This lesson discusses specific ethical and legal issues: fraud, theft, and diversion. It is critical to understand these topics to protect yourself and your patients. Let's get started. First, let's define fraud, theft, and diversion in the context of medication administration. Fraud involves intentionally deceiving or misrepresenting information to obtain medications unlawfully. This could mean a healthcare professional forging prescriptions or manipulating patient records to acquire drugs for personal use or sale. Theft is the act of unlawfully taking medications from healthcare facilities, patients, or other sources without permission. Diversion refers to the redirection of legally prescribed medications for illegal or unauthorized uses. This can happen within healthcare settings when medications intended for patients are instead used by healthcare professionals or sold on the black market. Let's look at a scenario. A nurse in a long-term care facility systematically overorders opioids for patients under his care, then diverts the surplus for personal use. This not only constitutes theft and diversion, but also places patients at risk due to inadequate pain management. Understanding these terms sets the foundation for recognizing, preventing, and addressing these illegal activities, ensuring patient safety and regulatory compliance. In order to recognize fraud, theft, and diversion, it is important to understand the signs and symptoms. Signs and symptoms indicating these activities might include unusual patterns in medication orders, repeated overordering or underutilization of prescribed medications. For example, it is a red flag when a resident gets pain meds the days a certain nurse is on duty but doesn't on other shifts or when other staff work. Discrepancies in inventory, unaccounted shortages or surpluses in medication stock. Behavioral changes in staff, such as mood swings, altered work performance, or evidence of substance abuse, such as sudden weight loss, bloodshot eyes, or withdrawing from social interactions with coworkers. The consequences of engaging in or failing to report these activities can be severe, both legally and professionally. Legal consequences can range from fines to criminal charges and imprisonment. Professional consequences could include loss of licensure or certification, loss of trust from patients and colleagues, damage to professional reputation, and the potential harm to patients through mismanagement of their medications. In order to prevent medication fraud, theft, and diversion, facilities must approach the issue from multiple angles. Prevention should include strict monitoring, education, and creating a culture of accountability. 1. Strict monitoring. Implementing stringent inventory controls and using technology, such as automated medication dispensing systems or AMDS, to track medication movements. For example, diligent use of the controlled substances form can prevent theft. 2. Education. Regular training for staff on the importance of medication security and the signs of potential diversion. For example, regular training can keep staff up to date about the signs and symptoms of substance abuse. 3. Creating a culture of accountability. Encouraging open communication and reporting of suspicious activities without fear of retribution. For example, providing avenues for anonymous reporting. By adopting these strategies, healthcare settings can significantly reduce the risk of medication-related misconduct. This not only protects patients, but also upholds the integrity of the healthcare profession. In summary, fraud, theft, and diversion are specific issues within medication administration. Fraud involves intentionally deceiving or misrepresenting information to obtain medications unlawfully. Theft is the act of unlawfully taking medications from healthcare facilities, patients, or other sources without permission. Diversion refers to the redirection of legally prescribed medications for illegal or unauthorized uses. It's important to recognize the signs and symptoms indicating these activities, such as unusual patterns in medication orders, discrepancies in inventory, and behavioral changes in staff. Engaging in or failing to report fraud, theft, and diversion can lead to legal and professional consequences. In order to prevent fraud, theft, and diversion, facilities should engage in strict monitoring, staff education, and create a culture of accountability.